Hello everyone, a very warm welcome to another webinar from PsychSpace. Today we are going to explore the topic of mental wellness in geriatric care. The geriatric population refers to individuals who are considered elderly or older adults, typically aged 65 years and above. This demographic experiences age-related changes in physical health, cognitive function, and their overall well-being. As the world's population is growing older, it's more important than ever to focus on the mental well-being of our elderly community members. Joining us today are essential esteemed experts who possess the knowledge and experience in the realm of geriatric mental health. Allow me to introduce our prominent speakers. Firstly, we have Ms. Priyanka Bhattacharjee, who is a two-time gold medalist and a RCI licensed clinical psychologist. She is currently working as a consultant psychologist in Apollo Hospitals and is the founder of PsychSpace. Secondly, we have Ms. Yeza Chaudhry, who has been a mental health enthusiast since a very young age, and Ms. Yeza Chaudhry has done her master's in clinical psychology from Christ University and is currently working as a psychologist at PsychSpace. Next, we have Ms. Priyanshi Barua, who has done her specialization in medical and psychiatric social work from Assam Downtown University. She is currently working as a geriatric counselor. Lastly, I, Deepshikha Kalita, I have done my specialization in clinical psychology under Assam Downtown University, and currently I am also working as a psychologist at PsychSpace. I heartily welcome all of our speakers. Thank you for dedicating your valuable time to be with us. I'm certain that our viewers are eagerly looking forward to this discussion.
Thank you so much, Deepshikha. It's a very pleasant moment for the whole team of PsychSpace to come together. So I'm very happy to see the young and dynamic team of psychologists and social workers working within the field of mental health and enriching and enhancing experience of people they are coming across. And today, I'm very proud to have my whole team, not a whole team, a part of my team, where we are going to address a very key concept and a very key issue of geriatric mental health and the role of mindfulness techniques. So I guess just before Deepshikha put forward the session and initiate the discussion, I would like to just give an overview of what PsychSpace has been, functioning and how it has been working in this field. So PsychSpace, born in the year 2020, in the middle of the pandemic situation. I think we have sailed a journey where we have seen a lot of ups and downs of the pandemic, and ups and downs as in, like, the experience of people, resulting into a lot of people reaching out to us through online intervention, to the impact the pandemic situation has made on the on the journey of this organization, shifting from both in person to digital intervention and so on. Very proud moment for me, being the founder of this organization, how we have sailed so far, and with more dynamic psychologists and social workers joining the team. And right now, as we are functioning in Guwahati, with the clinic in Jayanagar, and also a very significant initiative in collaboration with Nerigain, which is an elderly assisted living center, and where PsychSpace play a very important role of providing the services of geriatric mental health and clinical psychology, where the team of PsychSpace is taking care of the cognitive rehabilitation of the elderly patients who are who are residing there or who are attending there as an OPD individual. And yes, this is a very small, a very brief thing to talk about. And as we will unfold the today's session, and as Dipshika being the moderator, as she will, help us sail through this particular session, we'll discuss more of the geriatric, the concerns. Okay, so over to you, Dipshika. So I wish you all the best for the session.
Introduction. We are all very honored to be part of your team. So, without wasting much time, let's just delve right into our topic. As we know, the geriatric population consists of the elderly. So, when talking about the mental health care of this specific group, what sets it apart from the usual mental health care, and why is there a need to talk about it?
Right. So uh, I think I'll take this conversation a little bit in different language. অকমান অসমীয়া, English, মাজে মাজে হয়তো হিন্দীৰ আমি প্ৰয়োজন কৰিম। আহ, যেতিয়া আমি জেৰিয়াট্ৰিক মেণ্টেল হেল্থ বুলি কওঁ, যিখিনি এল্ডাৰলি ইণ্ডিভিজুৱেলছ ইন দ্য ছ'চাইটি, তেওঁলোকৰ কাৰণে আমি এটা স্পেচিফিক এটা ডেডিকেটেড ছাৰ্ভিচ আমাক লাগে, so that we are more able to work on their well-being, enhance their quality of life, work on the different challenges they face. কাৰণ এই যিখিনি এল্ডাৰলি যিখিনি পেচেণ্টছ থাকে, আৰু মই পটককে পেচেণ্ট বুলি কৈ দিয়াটো উচিত নহয়, কাৰণ আহ, গোটেইখিনি মানুহ জেৰিয়াট্ৰিক পপুলেশ্যনত থাকে, গোটেইখিনি মানুহ পেচেণ্ট হিচাপে নাথাকে, কিন্তু তেওঁলোকক এটা ছাপৰ্ট বা মেণ্টেল হেল্থ ছাপৰ্ট বা কগনিটিভ এনহেঞ্চমেণ্ট ছাপৰ্ট, ছ'চিয়েল ছাপৰ্ট, এটা ইম'চনেল ৱেলবিং ছাপৰ্ট এটা খুবেই জৰুৰী। আৰু the one thing I guess which actually makes it very different is the more of emphasis on the well-being aspects, on enhancing the quality of life, even before something has really stuck them, and which actually requires attention of a clinical psychologist or a mental health professional. So this is where it makes it very different. And when it comes to geriatric mental health, a lot is being emphasized upon the support system for the person, for the elderly individual, the support system which provides social support and emotional support, right? A kind of ecosystem that is built around that individual, so that the individual is, number one, not felt to be left alone, doesn't feel that the individual, since the person is aging, তেখেতৰ ক্ষমতাখিনি কমি গৈছে, because that is one very important concern, or that is one very important emotional component, which almost a lot of people in this particular age group, they express, মই আগৰ নিচিনা হৈ থকা নাই, আগৰ নিচিনা নাই, আৰু আগৰ নিচিনা দিনবোৰ নাই, আৰু মই আগতে বহুত কাম কৰিব পাৰিছিলো, আগতে মই ইমানখিনি কাম কৰিব পাৰিছিলো, আগতে মই ইমান পঢ়িব পাৰিছিলো, আগতে মোক ভাগৰে নালাগিছিলে, আজিকালি ইমান ভাগৰ লাগে, অলপমান কিবা এটা কৰিলেই ভাগৰ লাগে। চ' তেওঁলোকে এই যিখিনি এটা চেঞ্জ, এটা পৰিৱৰ্তন যিকেইটা এটা হয় উইথ এজ, সেইখিনি চেঞ্জেছ আমি তেওঁলোকৰ লগত আগবাঢ়ি পেলাই তেওঁলোকক এটা ছাপোৰ্ট এটা দিব লাগে। বিকজ মোৰ we talk about this change, and change being a very permanent thing and something very usual, we need to adapt to the change, and we should also help them to adapt with the change. So that kind of a mechanism and approach makes it very different from any other, the specialization of any other specializations made in the field of mental health. And why it is very important to talk is the fact that this geriatric, or the senior citizens, or the elderly, so this is something which all of us are going to come through, right? This is something which is inevitable, and it is universal, right? This experience will come to each one of us at different time and aspects, but it will definitely come to us. So why it is very important to keep talking about is to to generate a very usual awareness of the changes that will come along, of the the decline into certain of our capabilities, okay, maybe in terms of our strength, maybe in terms of our attention, maybe in terms of our a little bit of our functionality. And it's okay to seek for a support, it's okay to seek for a help, to normalize these concepts to normalize these functionings and and this entire experience. And that's why it's very important to keep talking about geriatric, to talk about the experience the elderlies have. And as I said, not everything is a problematic situation, not everything is at a disorder level. But yes, certainly we can work a lot to preserve our functionalities and be more mindful of our changes. I think that is the crux of today's session of mindful aging. And the mindful aging will nothing be but the acceptance, the very conscious effort made towards a acceptance, towards the changes the entire body, the physiology, the emotional components, our cognitive functioning, every other functionality will come across. And you know being more at par with that change, being more at acceptance and be at more of awareness of those changes is what this whole of the mindfulness experience is all about. And this mindfulness aging, as in the session, as we will unfold with Yeja and Priyanshi, will talk more about their inputs of the mindfulness techniques and interventions, or how these practices are helping the elderly population. But we have seen that these mindfulness techniques, mindfulness practice really enhance on their cognitive functioning, and it actually slows down the decline, the rate of decline that will eventually come as a part of aging. So that decline is being slowed down. Those functionalities have been better preserved, be it terms of the cognitive functionings like the attention issues, concentration, emotional regulation, okay, better motor functioning. All right. A lot of different pain experiences. Pain is one very important aspect of health, be it physical health and mental health, when it comes to the geriatric care. So that's very important to understand the concept of pain and how to help them for the pain management. So yes, this is very important to keep talking, and to very importantly focus on an age group which who are into their uh, middle life, okay, and who are into their who are approaching their late adulthood, who are approaching their the retirement age, right? So it's very important to keep them mindfully aware of the things that are coming their way, so that they're more prepared and they have a better control of their functionalities, and that will make them feel more secure, more accepted towards themselves, and that will also make them remain have that acceptance towards the change that they are going to experience. All right. So with this, I guess, thank you so much for having this question, because this is the essence of the whole session, and the also an essence of the whole initiative to generate a lot of awareness towards geriatric care, because this webinar is just a very small initiative and there are a lot of more initiatives to come, more of digital awareness or more of awareness in person to spread it in the society is likely to come. And with that, yes, I would like to sum up my response to the question made. Okay. And also, like, my team will definitely take forward this session, but due to a professional commitment and I have an appointment of a client at 9 o'clock, so I would like to wrap up the session a little bit earlier on my part, so that I can give my time to the other client. Okay. But I would also like to really wish Yeja, Priyanshi and Dipshika all the best. And Priyanshi particularly, I would really request you to put across your insight and share of experience of the kind of interventions that we do at Narrigame, and the essence of the cognitive rehabilitation techniques that we are constantly using, and the kind of impact that we have seen on our Pokai Nitas. And yes, that's very important to highlight. And not, I mean it's not really really essential to mention that I'm so much proud of the whole team, the kind of initiative they have been working in the field of geriatric mental health. So I wish the team all the best for all the endeavors, and also for the coming session. Right. So, Dipshika, please do allow me to leave the session, and I would request both of you to please carry forward the session for today.
Thank you, Priyanka ma'am, for your insightful input. And yes, I agree with whatever you said because geriatric mental health care is holistic in nature and it is universal, as you said. None of us can escape it. And yes,
Yes,
there's
we
like a
cannot
very
escape it. It's going to
yeah.
come to us as well.
That's why it's very important to normalize it. Thank you so much for your time, ma'am. We'll be
Thank
taking
you.
this session forward with Yeja ma'am and Priyanshi ma'am.
Yes.
Thank
All
you
the
so much,
best
ma'am.
to all of you. And I'd really like to be part of all these sessions once again. Really love to talk to people. All right. Thank you so much. Please allow me a leave for now. Right. Thank you.
Sure. As Priyanka ma'am has opened up our discussion, now let us move forward. Moving on, I would like to know what are the key components of mental wellness in geriatric care?
Dipshika, I would like to go forward with the question.
Sure.
As Priyanka ma'am said, like when we talk about geriatric mental care, geriatric mental health, it is something that is universal. All of us are going to, enter that age, enter that stage some time in our life, right? When we talk about components, there are multiple components that plays role. It's not just the physical, it's not just the cognitive. It's like a combination of like different components together. So I would put forward like what few components. The first one is the emotional well-being of our geriatric population. So when we talk about the emotional well-being, with them reaching that age, with that age comes a lot of sense of grief. They might go through grief, they might go through stress. There is like increased loneliness. There is, they might also go through a very less motivation, I would say, decreased motivation, hopelessness, helplessness, because they are not like before. তেখেতৰ গাটো শৰীৰটো আগৰ নিচিনা নাই এতিয়া. So there are a lot of things that change over the time, right? So when we talk about that, so with that essence, the emotional part is also something that we neglect most of the time, because there's been a lot of time when like the elderly are at home, their kids go out, they have their separate life, they have their own education to follow and like their own career to follow and stuff like that. So emotional well-being should be like one of the key component, and this is something we really work upon in PsychSpace. Apart from that, the cognitive health of our elderly community. When we talk about the cognitive health, it's basically about the functioning of the brain, the cognitive functioning. So we should engage them in more brain stimulating activities such as reading, puzzles, and then giving them some new activities to do on a regular basis, just so that the brain is stimulated, the brain gets to know something, the brain gets to learn something, even if that thing is something very simple or very small to them. But it's just that importance for the brain to be stimulated is something that we should keep our focus on, so that like there is like the so that we can prevent the cognitive decline at that age, because we know that with age there comes cognitive decline. The cognitive functioning do decline with age, right? So when we talk about that, the one of the way through which we can prevent the cognitive declination is through stimulating activities, brain stimulating activities. And so in that, the brain is somewhere, it's functioning, because after retirement, what we usually see our grandfathers and grandmoms doing, basically mostly grandfathers. They would wake up in the morning, read a newspaper, have a cup of tea, and basically throughout the day they just have some minimal interaction if there is someone at home, and then watch TV a little bit, read again a newspaper maybe, or just sleep a lot of time. That's what they do on a regular basis, right? But apart from these functioning, we should definitely add some sort of brain stimulating activities, so that there is a prevention in the decline of cognitive functioning, basically. Now, as Priyanka ma'am said in the initial introduction, that with age there is a lot of bodily complaints, be it physical pain, I mean, the pain is one of the consistent thing that they go through on a regular basis when with age. So keeping a minimal physical exercise or physical activity, be it just walking or be it just doing some physical activity, would keep them, keep their mental wellness, keep them overall well. And then definitely about stress management. When we talk about stress management, there are a lot of coping activities, and there are a lot of coping techniques through which we can help them. But one of the most significant is having a quality time and having interaction with people, because we know with that age comes a lot of loneliness, comes a lot of alone time. So when they speak, when they speak to other people, when they interact with other people, that will definitely boost their mental well-being. And yeah, I think that's how I want to respond to the question. So yeah, these were a few points from my end.
Thank you, Rija ma'am, for putting it so beautifully. And yes, I agree that as you have mentioned, it is a period, it's like a period of transition, you know. There are a lot of changes. They go through a lot of changes emotionally, physically, and cognitively. So, yes, they need a lot of support at this stage of time. So, I would like to put forward the next question and ask that what are the most common challenges faced by the aging population and how can those challenges be effectively addressed?
Thank you so much, Dipshika, for your question. As we all know that when the age used to move forward, everyone's functioning used to reduce. And along with that, the aging population includes the depression, anxiety, dementia, and the most we see is the loneliness. This can be addressed through various means such as therapy. Therapy may include CBT or DBT and other evidence based therapies which can help develop coping skills and also manage their emotional skills. And then medication as well. In some cases, medication by psychiatrists can alleviate symptoms of conditions like depression, anxiety, and bipolar disorder as well. Then lifestyle change, which can include like regular exercise in their daily routine, proper nutrition, sufficient sleep, and yoga. And then social support also plays an important role in this, like building and maintaining healthy relationships with friends, family, and support group to reduce feelings of isolation. Then self care also plays a very important role in this field because engaging in activities each day on like daily basis is more important. That brings they should like engage themselves in activities which they like, that brings joy and helps them to relax as well. Then on professional support, they can seek help from mental health professionals like therapists, counselors, or psychiatrists as well. They can provide guidance. Then education awareness is also important because if they understand their own mental health challenges, and then they recognize the early signs and warnings, and then only they can know that where to seek the help. So yeah, these are the common mental health challenges, and then the ways we can promote.
Thank you, Priyanshu ma'am, for enlightening us with your answer. And yes, as you've mentioned about the lifestyle changes that happen at this stage, it accompanies a lot of things like obviously depression and anxiety, but most importantly comes the factor of loneliness as the children or the other people in their life either they pass away or they move out from their house. So they need a lot of care, and most importantly, self care is also there, which sometimes we only think about that self care is for the young population only, but it's not so. The elderly will also can be indulged in self care, and doing things that they enjoy will bring them joy. So these are the ways of supporting them. And also obviously another thing that you mentioned is social support, which is like a very vital thing for them. So thank you for your answer. And now I would like to know what are the innovative programs or interventions that have been successful in improving the mental wellness of the elderly population?
Okay, thank you for putting this question. Normally, as Mams has already mentioned that uh, the time the cognit as the time increases, the cognitive functioning also decreases, and cognitive function includes their brain stimulation activities, and then this. Okay, till date, several initiative programs and interventions has shown success in improving wellness and mental health in elderly population. So some of them are like one of this has been recently came up, and this is like very popular in last few years. That is telemedicine and telepathy. Here, they are provided mental health services in remote areas, which where uh, the population can't reach easily to get help on this aspect, especially during this COVID-19 pandemic. It allows elderly individuals to access therapy and counseling for the concept of their from homes, reducing barriers such as to reduce the barriers such as transportation and mobility issues. Then again, mindfulness and medication programs, introducing mindfulness based interventions such as mindful meditation, yoga. This all has been effective in reducing stress, anxiety, and depression. Among the elderly, these programs focus on present moment awareness as well, and can be also tailored to quite varying levels of physical ability. Then art and music therapy, we're engaging in creative activities like painting, drawing, or playing musical instruments has therapeutic benefits for seniors. Then art and music therapy programs like provide different opportunities for self expressions, social interactions, and obviously cognitive stimulation, which is much more important for this age group. And then yeah, promoting overall mental health well-being. Then again, physical activities, this exercise programs designed specifically for elderly peoples not only improve their physical health but also they put a positive impact on their mental health. Activities, simple activities just like walking, tai chi, which is a Chinese name, uh, and then chair exercise, and then enhance This enhance the mood, reduce anxiety, and improve cognitive function. Then inter uh, intergenerational programs. In this particular thing, uh, how to say this, brings back together the different age group of peoples through different sort of activities such as mentorship programs, then volunteering opportunities or shared recreational activities, social connections, and sense of pursuit among elderly individuals, which are important for mental wellness. Then the cognitive stimulation program, which we also used in the daily basis in Neri game, that's also called as CRT, cognitive remediation technique. This cognitive training exercise includes, as ma'am already mentioned, the puzzles, the brain games help maintain cognitive function and they help to reduce the sink of the developing dementia, Alzheimer's, such sort of things. Like these programs can also be offered in groups of settings, individual as well, and through digital platforms. Then animal assisted therapy. This therapy interactions with focus on interaction with animals. Then it has shown to reduce feeling of loneliness. This particular type of therapy is not only used only for this group, it can help with any age group. Then also it supports emotional support, companionship, etc. Then one of the another important point is peer group support. This peer group support provide a platform for all elderly individuals to share their experiences, challenges, and coping strategies with others who may be facing similar issues. This group often uh, can be called as emotional support group, and then for validation and a sense of belonging as well. Yeah, so these are the like main key points of intervention that can be put in place. So yeah.
Thank you so much, Priyanshi ma'am, for such an elaborate answer. I'm sure our viewers have gained a lot of insight from your answer. Yoja ma'am, do you have anything to add on this?
Dipshika, I think Priyanshi has very well explained each component of the techniques that can be used. But I just want to elaborate a little bit on what she said before, like the practices we do in Nerigim and the practices we do on a regular basis to our elderly population out there. The thing is that the intervention of CRT plays a very crucial role in the management of cognitive decline, because as we know that with that age there's a lot of, like I said before, there's a lot of cognitive decline. But these are few things which we cannot prevent it happen, because these are basically the result of neurons that have, yeah, that has gone old and that has like suffered a little bit of damage throughout the period of life. So in that sense, what we do is like we try to manage it better, you know if we cannot prevent it completely, but we try to manage it. So how do we manage this thing? So one of the most scientifically proven method is like the CRT, that we call as cognitive remediative therapy. In that therapy, we basically give like small activities to do for them to do, be it reading, making, solving puzzles. We have those derailment things, then match and following things. Then we have like stick figures, where we ask them to put sticks properly, and we will show them a figure, and they'll have to recreate that same figure, imitate the same figure, and do stuff like that. It might look as like these therapies are like very vague, and these are like very, you know um very, I would say, something that kids play with, but the thing is that as a kid, we tend to make them understand each and every aspect of our brain functioning, like be it decision making, be it the executive functioning, the working memory, and all different sort of memory, the language, the visual spatial memory and stuff like that. We try to teach kid all of these things because they're unaware of those things. But with age, even though they have gained those understanding and gained those functioning, with age it declines. So we try to stimulate them with the same amount of puzzles, reading, and activities through which they can manage their prevent they can manage their declination, right? So this is something we do in our geriatric center, that is Nerigim. And apart from that, because they face a lot of loneliness, the thing that Priyanshi said, the peer support. See, at that age, a lot of their friends may not be present in their life anymore, you know or other friends are going through something really difficult. So, but it is very important for them to connect with people, to be surrounded with people, so that they can also talk. We all are, like, humans are called as social beings. Like, what does social being means? It means that we need another people, we need someone to talk to. Just because we are aging, they are aging, it is not that only youngsters or only kids needs friends to play, or like youngster needs friends to hang out with and stuff like that. But they do need social interaction. Keeping that in mind, we can definitely help like them by taking them to daycare centers and taking them to places where there are more people. They can meet people of their own age or even younger to that age. The the focus should be on interaction. The focus should be on social interaction, basically, where they can share, express what they are feeling, how they are going through, and even they can have someone else's opinion in through someone else's opinion in their life as well. Basically, to have an interaction where they can share whatever they're feeling and whatever they're going through. It may look like a very vague and small thing, but to be very honest, at that age, it is even difficult for people to get out of the bed. So having people to interact is a definitely a bonus thing that would definitely stimulate their brain so much in the whole functioning. So I think, yes, that's all I had to add for this particular question. And Priyanshi already had like mentioned a lot of points which definitely makes it much more important.
Thank you, Rija ma'am, for stressing upon the importance of cognitive stimulation at this age and also the role of CRT. Now, going ahead, I would like to know how can we promote mental wellness as a priority in geriatric care, and what are the policies and practices?
Um, I would like to go ahead with this question, Dipshika. So, when we talk about the promotion of mental well-being, I feel like a lot has been neglected for the geriatric population, because we mainly focus on the adolescents or the young adult. I mean, like the children, and then the adults. But I think when we talk about mental health in this specific community, in this specific age range, is something which is neglected, you know. But it is very important to address their mental well being as well. And that begins with training and education. Training and education, as in like including geriatric courses in the field of psychology, and the people who are doing psychology or counseling, I mean like clinical psychology or counseling psychology, basically to give them a proper training and understanding that this age range is also very important to talk about. This age range is also demands our attention, and what they are going through how they are dealing with their mental health. So training and education is something very important, and there should be more diploma courses, and there should be a lot of else training and education, and where people are understanding and talking about it and knowing and learning in like proper theoretical and proper evidence based research and stuff like that. The another point that is very much important is like integration of mental health services in the hospitals, NGOs, old age homes, because we know there are a lot of old age homes, NGOs, and hospitals that actually focuses on geriatric health, but they somewhere again falls behind when it comes to mental health. So there should be a integration of the mental health part as well, because when we talk about health, we talk about both mental and physical health. It cannot be only our physical health, right? So we need to focus on that as well. And adding to that, there should be, and there is actually a lot of places where the screenings and assessments are done. When I talk about screening and assessment, what I basically mean is that people feel that there's a lot of things, there are a lot of places where you don't know how the mental functioning is happening, how the mental functioning of the geriatric population is. But there are assessment, there are screening tests which we can do with them, be it like the GDS, we call it the geriatric depression scale, be it MMSE, be it MOCA. These are all specific tests and assessments which basically talks about and speaks, I mean, like, it shows proper significantly how is there a significant cognitive decline, is there anything that we need to worry about, or how they are overall functioning cognitively. Apart from that, I think we need awareness programs. Like the one we are doing right now, and obviously a lot of community support programs, definitely. When we talk about support groups, we mostly talk about support groups for adolescents. Again, we mostly talk about support groups of adults, but it is so important for us to understand that we need support group for them as well. We need, and that is only going to happen when we spread awareness about these kind of issues, and when we focus on the geriatric mental health. So I think, yes, these are the few points I have from my end. So yeah.
Thank you so much, Yoja ma'am, for your wonderful answer. Do you have anything to add, Priyanshu ma'am?
Priyanshi, can you hear us? I think Priyanshi is having some internet difficulty. We'll move
Okay.
ahead.
Uh, Priyanshu ma'am seems to be having some kind of technical difficulty. But yes, Yaja ma'am have really covered all the points. And so now we've come to the end of our session. I would just like to highlight all the major points that have been covered today. So first of all, as Priyanka ma'am mentioned in the earlier conversation, that this age group is going through a period of change, and oftentimes they are overlooked, and their mental health care or their normal health care is also not that talked about. So there's like a very important need to normalize talking about geriatric mental health care. Then we talked about components of mental wellness in geriatric care, like their emotional component, their cognitive component, their physical component, and it is very holistic in nature. Um, as we know that it is the age where a lot of issues arise, and so we have to give the care in each and every aspect. And There's also the most important aspect that we talked about is the social support and how much, as we know, loneliness can affect the geriatric population a lot. And we have seen this in our homes, or we have seen this with our neighbors or someone else. So this is very like common, and so the social support is very crucial. Then we've learned about some of the programs and interventions or the therapies that are used, like CBT, DBT, and also just by using social support, a lot of the and a lot can be improved, because when we are surrounded by our peers, when we are surrounded by others, a lot of joy and happiness can be seen. And then we have also seen how can we promote this further. We can promote the geriatric mental health care by introducing certain training, research, and opening up discussions like this, and going further using certain screening tests, and approaching geriatric centers as such. And so this was a overall discussion, and I urge our
Deepika,
audience.
just a minute. Yeah, I think there's a comment that we got from our viewer.
Yes, yes, I am
Yeah.
going to address it.
Yes. Okay.
Yes, yeah. As I was saying, we should all approach these centers, and we should all look after our elderly friends as best as we can. And after this, I'm going to address the comment that we got. Um Mr. Salman Khurshid Mazumdar said that this stream is really informative, because the care in geriatric care and the ones we do in our homes for our elderly is quite different. Thank you so much for leaving this lovely comment. And we agree. We agree with what you've said. And yes, uh, we can care for our elderly friends at our home, but there to a certain extent, because we are all leading busy lives at this moment, and sometimes the focus that we would like to put, or the effort we would like to put forward, is not enough. And so yeah, geriatric care basically looks after that in a holistic way. So thank you so much for your comment. With that, we've come to the end of our session. Finally, I would like to extend my sincerest gratitude to all the speakers for enlightening with such knowledgeable words. Also, thank you to our viewers for your love and support. PsychSpace is available in every social media platform. Follow us on our Instagram page for our latest updates, and we are just a DM away if you need any kind of professional help. Thank you to all. Have a good night.
Thank you, Dipshika, for the lovely session. Thank you so much.
Thank you, ma'am.